Does substance abuse commonly co-occur with autism? Have you ever wondered about the connection between substance abuse and autism spectrum disorder? This is an important topic that deserves our attention. Research indicates that individuals with autism spectrum disorder are at a higher risk for developing substance use disorders compared to those without autism. This risk can vary based on age, mental health conditions, and patterns of substance use. Many autistic individuals may turn to substances as a way to cope with social challenges or sensory sensitivities. Some may struggle with self-regulation and find that substances provide temporary relief. The repetitive behaviors and hyperfixation often seen in autism can sometimes lead to patterns of substance use. Additionally, the desire to fit in socially or manage symptoms of anxiety and depression can lead to self-medication. Studies show that about half of autistic individuals may experience substance abuse or addiction at some point in their lives. However, the rates of substance use disorder diagnoses in clinical settings may appear lower. This is partly due to underrecognition of substance use issues in this population. For example, recent data suggests that around 7% of autistic adults without intellectual disability had a substance use disorder diagnosis. This number is likely an underestimate because symptoms can overlap with other mental health conditions. It is also important to note that the risk of substance abuse is not limited to those with autism. Family members of autistic individuals may also be more vulnerable to substance-related problems. This suggests that there could be shared genetic or environmental factors at play. Therefore, the risk for substance use issues can extend to relatives who do not have an autism diagnosis. Co-occurring mental health conditions, such as attention deficit hyperactivity disorder, anxiety, or depression, can further increase the risk of substance abuse among autistic individuals. When these conditions are present, the likelihood of developing a substance use disorder rises significantly. For those involved in autism care and support, it is essential to be aware of the increased risk for substance abuse, especially in individuals who receive a late diagnosis or have additional mental health challenges. Early recognition of substance use and tailored support strategies can help reduce harm and improve outcomes. It is also vital to consider the unique needs of autistic individuals when designing prevention and intervention programs, as traditional approaches may not always be effective. While substance abuse is not universal among autistic individuals, it is common enough to warrant attention and support. Understanding the reasons behind this increased risk can help in providing better care and support for autistic individuals and their families.